What if I told you there's something about Canada that keeps Americans awake at night? Something so powerful, so life-changing that it has quietly captured the envy of millions. In the next few minutes, you'll discover the shocking truth that most won't dare to say out loud. Every Canadian citizen and permanent resident has access to medically necessary hospital and physician services without facing direct charges at the point of care. In practice, this means no copays, no deductibles for most services, and no fear of bankruptcy because of a medical bill. The longer waits tend to occur for non-urgent, elective procedures. Even then, Canadians have peace of mind that their care is covered and not financially devastating. Stay with me, because what you're about to hear will challenge everything you thought you knew about healthcare and why America's biggest fear might just be Canada's greatest strength. Each province manages its healthcare independently, but follows the Canada Health Act's national guidelines. In Canada, this simply doesn't happen on the same scale. Prescription medications are cheaper, administrative costs are lower, and the private insurance bureaucracy that burdens Americans does not exist in Canada. Canadian doctors and American patients alike reveal the emotional, financial, and social toll of the U.S. healthcare system. On the other hand, an American cancer survivor recalled accumulating over $400,000 in medical debt despite having insurance. Canadians see healthcare as a basic human right, not a privilege. It is embedded into the national identity. These stories bring humanity to the statistics and frame the conversation in lived experience. Segment 1. The foundation of Canadian healthcare. Canada's healthcare system is built on the principle of universality. Most Canadian doctors are not government employees. They run their own practices and simply bill the government rather than private insurance. Studies show that this is extremely rare and often overstated by media sources with political agendas. Meanwhile, in Canada, healthcare is not a political battleground. These groups spend billions to influence public perception and political decisions, often by demonizing universal healthcare models like Canada's. It's a national value. In the U.S., affordable healthcare is often used as a divisive political issue. Canadian hospitals provide choice, timely emergency services, and high patient satisfaction. The Canadian single-payer system is a collaboration between the federal and provincial governments. They don't worry about being denied coverage for pre-existing conditions. This security leads to better mental health, job flexibility, small business growth, and a higher overall life satisfaction. Canada's hospitals are modern and diagnostic equipment is widely available. Canada ranks competitively among high-income countries in health outcomes and patient satisfaction. Despite criticisms that Canadians face long wait times, most emergency medical cases are handled promptly. In contrast, in the U.S., many workers stay in unfulfilling jobs just to keep their health insurance. It's about knowing that your health will be protected no matter your employment status, income level, or life circumstance. Prescription drug prices are exponentially higher in the U.S. compared to Canada. Let us know your experiences, your challenges, and your hopes for a better healthcare system wherever you live. Thank you for joining me on this journey, and I'll see you in the next one. Administrative costs tied to private insurance layers make the American system even more expensive and fragmented. Segment 2. The financial contrast. Why cost matters. One of the biggest reasons Americans look at Canada with envy is the cost. But the core difference lies in how the systems value human dignity and financial security. The United States spends more per capita on healthcare than any other country, yet many Americans still cannot afford necessary treatments. Canadians pay significantly less for their healthcare through their taxes and never worry about losing coverage because they lose a job. The cost disparity is staggering. Americans are often trapped in a cycle of medical debt, with some resorting to crowdfunding to cover life-saving treatments. Consider the stories. Americans driven into debt by astronomical hospital bills, people rationing insulin or skipping medical appointments due to cost. Segment 3. Real-life stories from both borders. Real-life stories bring this issue into sharp focus. We hear from Canadians who received life-saving care without ever seeing a bill and Americans who have faced bankruptcy or denial of life-saving procedures. One Canadian woman shared how her cancer treatment including multiple surgeries and chemotherapy, was fully covered without question. These narratives reveal a deep systemic divide: the freedom to seek care without hesitation in Canada versus the fear-driven choices many Americans must make daily. Segment 4. Debunking myths about Canadian healthcare. Many Americans fear the term government-run healthcare, but Canada's model is misunderstood. The notion that Canadians have access to outdated technology is false. There is also a myth that Canadians flock to the U.S. for healthcare. Segment 5. Media influence and political narratives. The U.S. media, influenced heavily by the powerful private insurance and pharmaceutical industries, often paints Canadian healthcare in a negative light. The U.S. healthcare debate is often steered by lobbyists who represent the interests of private insurers, hospital corporations, and pharmaceutical companies. In this segment, we delve into how partisan politics and industry lobbying shape American perceptions of Canadian healthcare, often misinforming the public. Segment 6. The psychological impact of healthcare security, perhaps the most important yet least discussed reason. Americans envy Canadian healthcare as the psychological relief it offers. Canadians don't face daily anxiety about medical bills. They don't hesitate to seek care for fear of financial devastation. Studies indicate that Americans frequently delay care, skip medications, or avoid hospitals altogether due to cost concerns. This chronic stress impacts mental well-being and even shortens life expectancy. Canadian entrepreneurs can start businesses without the fear of losing healthcare coverage, fostering innovation and economic mobility. Segment 7. Final reflections. Is the grass greener? Is Canada's system perfect? Of course not. No system is flawless. Canadians occasionally face bureaucratic challenges and delays for non-urgent care. The fundamental reason Americans are envious is because the Canadian model offers dignity, financial security, and the ability to live without the looming fear of medical ruin. It asks about more than just numbers. It asks about the value of life and peace of mind. If you found this discussion enlightening, please like, subscribe, and share your thoughts in the comments.